Pharmacology, gastrointestinal system, constipation. The pathophysiology of constipation. Constipation is defined as 3 or fewer bowel movements in a week. Stools that are hard, dry, or lumpy, stools that are difficult or painful to pass, or the feeling that not all stool has passed. If defecation is delayed for an extended time, additional water is absorbed, thus making the feces firmer and potentially leading to constipation. There are several causes of constipation, such as lack of proper fluids or fiber in the diet, lack of ambulation, various disease processes, recovery from surgical anesthesia and opiates, and side effects of many medications. A list of these potential causes can be found. Because there are several potential causes of constipation, treatment should always be individualized to the patient. Many times, constipation can be treated with simple changes in diet, exercise, or routine. However, when medications are also needed to resolve constipation, there are several categories of laxative medications that work in different ways. Classes of laxative medications are described below. Some common causes of constipation include medications, antacids that contain aluminum and calcium, anticholinergics and antispasmodics, anticonvulsants used to prevent seizures, calcium channel blockers, diuretics, iron supplements, medicines used to treat Parkinson's disease, narcotic pain medicines, some medicines used to treat depression, health and nutrition problems, such as not eating enough fiber, not drinking enough liquids or dehydration, not getting enough physical activity, celiac disease, disorders that affect the brain and spine, such as Parkinson's disease, spinal cord or brain injuries, diabetes, hypothyroidism, inflammation linked to diverticular disease or proctitis, intestinal obstructions, including blockage and tumors, daily routine changes, pregnancy, aging, traveling, ignoring the urge to have a bowel movement, medication changes, change in diet. Considerations. Assessment. The nurse should assess for potential causes of the patient's constipation and appropriately individualize the treatment and patient education. The nurse should document an abdominal assessment that includes discomfort, distension, and decreased bowel sounds. The date of the last bowel movement should also be documented. The patient may be asked additional history questions, such as the appearance of the stool, to determine if it is hard and dry, if passing the stool is difficult or painful, or if there is a feeling of incomplete emptying. Implementation. Many facilities have a bowel medication protocol with progressive treatment of constipation, ranging from stool softeners to stimulants to enemas, depending on the length of time since the last bowel movement. Medications should be administered according to label instructions, and the patient should be instructed when to expect a bowel movement will occur. Measures to prevent constipation should also be discussed with the patient. Patient teaching for all classes of laxative medications should be individualized based on the cause of constipation. Measures to prevent constipation should be reviewed with a patient, such as getting enough fiber in the diet, drinking plenty of water and other liquids, getting regular physical activity, trying to have a bowel movement at the same time every day. Evaluation. If bowel movement does not occur within the expected time frame, the provider should be notified and other causes investigated for individualized treatment. It is imperative that good documentation of bowel movements and communication among staff occur when constipation is being treated with various medications. If there is a complete absence of bowel sounds, worsening distension or abdominal pain, a smearing of stool or other findings indicating that a paralytic ileus or blockage may be occurring, the provider should be immediately notified. Laxative classes. There are 5 categories of laxative medications commonly used to treat constipation: fiber supplements, stool softeners, osmotic agent, lubricants, and stimulants. Fiber supplements and stool softeners are often used daily to prevent constipation, whereas the other laxative categories are used to treat constipation. Fiber supplements such as psyllium or metamucil are bulk forming to facilitate passage of stool. Stool softeners such as dulcosate or cholase facilitates the movement of water and fats into stool. Osmotic agents such as milk of magnesia or polyethylene glycol, Miralax, causes water to be retained within the stool, increasing the number of bowel movements and softening the stool so it is easier to pass. Lubricants such as a mineral oil enema coats the stool to help seal in water. Stimulants such as Biscodol or Dulcolax causes the intestines to contract, inducing stool to move through the colon. Fiber supplements such as psyllium or brand name Metamucil is an example of common over-the-counter fiber supplement. Psyllium in powder form. The mechanism of action of psyllium adds bulk to the stool to facilitate passage through the rectum. Specific administration considerations when administering: put 1 dose into an empty glass and mix with at least 8 ounces of water or other fluid. Taking this product without enough liquid may cause choking. Stir briskly and drink promptly. If mixture thickens, add more liquid and stir. Administer at least 2 hours before or 2 hours after other medications, as it can affect absorption. Psyllium usually produces a bowel movement within 12 to 72 hours. It may cause bloating and cramping. Patient teaching and education. When teaching patients how to take psyllium at home, in addition to the above considerations, advise them to start with 1 dose per day, but may gradually increase to 3 doses per day as necessary to maintain soft stools. Stool softeners. Dulcosate is a common over-the-counter softener that is also used frequently in healthcare settings. The mechanism of action: dulcosate facilitates the movement of water and fats into the stool to make it soft and improve regularity of bowel movements. Specific considerations is that dulcosate usually produces a bowel movement in 12 to 72 hours, and it may cause stomach cramping. Osmotic agents. Milk of magnesia and polyethylene glycol, or Miralax, are examples of common osmotic agents used to promote a bowel movement. The mechanism of action of osmotic agents cause water to be retained within the stool, increasing the number of bowel movements and softening the stool so it is easier to pass. Specific considerations for polyethylene glycol has a bottle top that can be used as a measuring cap to contain 17 grams of powder when filled to the indicated line. Fill to the top of the clear section in the cap, which is marked to indicate the correct dose. Stir and dissolve in any 4 to 8 ounces of beverage, and then administer. Patient teaching and education. In addition to the administration considerations above, teach patients that ethylene glycol usually produces a bowel movement in 1 to 3 days. It may cause loose, watery stools. Lubricants. A mineral oil enema or brand name Fleet enema is an example of a lubricant laxative. Read the drug label for children, as some brands can be used in children aged 2 or older, whereas others are not intended for children. A mineral oil enema generally produces a bowel movement in 2 to 15 minutes. It may cause stomach cramps, bloating, upset stomach, or diarrhea. Stimulants. Biscuit is an example of a stimulant laxative. The mechanism of action of biscuit causes the intestines to contract, inducing the stool to move through the colon. Specific administration considerations is that the oral dosage or rectal suppositories are available. A bowel movement is generally produced in 15 minutes. Biscuit may cause stomach cramps, dizziness, or rectal burning. To administer a rectal suppository, position the patient on the left side with the right knee up towards the chest. Suppositories should be coated at the tip with petroleum jelly. Remove foil and insert suppository well into the rectum, touching the bowel wall. Instruct the patient to retain suppository for about 15 to 20 minutes. A bowel movement is generally produced in 15 minutes to 1 hour. For children, read the drug label for dosage. Bowel movements occur within 1 hour. Stomach cramps, dizziness, or burning are potential side effects.